I have Asian eyes, and usually a double eyelid, but suddenly there's more than just a double eyelid. How can I fix that? As you can see, there are too many creases which are bothering me. Fat injection, or is there too much excess skin? Also, there are creases on my lower eyelid. I want to consult an oculoplastic surgeon in the US.
Thank you for your question. You've submitted two photos, and you state in your question that you normally have a double eyelid, and suddenly you've developed multiple creases in your upper eyelid. And you're concerned about whether or not the best solution would be a fat injection, or whether there's excessive skin. And also you mentioned that there are creases in the lower eyelid, and you're looking to consult an oculoplastic surgeon. Well, certainly I can share with you my approach to evaluating Asian eyelids. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and Asian eyelid surgery, in fact, is a major focus of my practice, both primary and revision surgery, and patients come to us from around the world for these procedures. So it's very important to have a basic overview of how I evaluate patients and determine what is the most likely course of action that will be successful. So to begin with, the first thing that I try to figure out is there excess skin? Is there overlap or excess fat? That differentiates or helps me determine the choice between incisional surgery, which means usually removal of some skin, or non-incisional surgery, which is the placement of stitches to create a crease. Both procedures, in principle, connect the skin to a muscle called the levator aponeurosis, the levator palpebrae superioris muscle. Now, the etiology or the cause of your current situation of previously having a double eyelid and then having multiple creases can be a couple of things, but more than likely it's a weakening of the connection between the skin and the levator muscle that gave you a defined crease. It is generally my approach that when someone that is younger and doesn't have a lot of skin and doesn't look like they have overlap of skin, I usually approach this by doing a non-incisional Asian blepharoplasty. This technique employs the placement of stitches that are permanent, placed through several little strategic entry points in the skin to engage the muscle and to basically create a little connection between the skin and the muscle so that when the eyes are open, you see a single crease. Generally speaking, this procedure works out very, very well and is relatively minimally invasive. Now, as far as fat injection is concerned, I don't think fat grafting in this area has any benefit. And I think that that's something that wouldn't even be a discussion. As far as the creases in your under eye area, those lines appear to be very, very fine. And I would probably suggest not doing anything about those lines because essentially they're subtle and they're just the natural result of facial expression. So as far as the upper eyelids are concerned, I think that you need a proper evaluation. Certainly, I think that you're in the right vicinity when you think about an oculoplastic surgeon. But I would say further, an oculoplastic surgeon with extensive experience with Asian eyelid surgery. Interestingly, as someone who's been a practicing oculoplastic surgeon for over 20 years, I can tell you that even within our specialty, which is already super specialized, there are many of us who mostly do older patients or do reconstructive surgeries, hospital-based, trauma. There's actually, with the specialty itself is actually is very broad, even though it's limited to a narrow specialty area. So look for an oculoplastic surgeon who does a lot of Asian eyelid surgery so that you can understand what their perspective is. And I think that we're dealing with a situation that is relatively straightforward. Of course, this is in the absence of a physical exam, and it's very important to have clarity about the outcome. You may still have, even with whether it's incisional or non-incisional surgery, you may still have a little bit of creasing of the eyelid, but you should be able to achieve a defined upper eyelid fold. And again, that's something that can be more easily predicted by physical examination. So I hope that was helpful. I wish you the best of luck, and thank you for your question.